being wrestled into this position while I'm sparring with my partner in martial arts can put a lot of unnecessary pressure on the front of my shoulder and lead to things like dislocation or front of shoulder pain. So I'm going to tell you how to be picky about how your shoulder sits in its socket while you're practicing martial arts. Hi, I'm Dr. Christina, the Picky PT, and I have been around a lot of martial arts students, not only because my son is in martial arts, but also because I've worked with several patients who suffer from repeated injuries in their shoulders from martial arts class. When you are being put into a submission position and your arm is being twisted behind your back, or you're trying to push away from someone or off the ground and you allow those shoulders to roll forward, this can lead to a lot of unneeded stress on the front of your shoulder. If you know you're going to end up in those positions repeatedly, you can try and make the tissues lax and ready for that stretch without tightening up and guarding every single time. But you don't want to become too lax, because that is how shoulder dislocations forward happen. If there's not enough tension in the front of your shoulder from your muscles, from your ligaments, from the capsule, then your humeral head can pop forward out of the socket and cause a lot of other long-term issues. So instead, when you are being wrestled in a position like arm behind your back, or if you're trying to push up from the ground, you want to make sure and use your shoulder blade muscles to hold that chest open as you're being wrestled, or as you're pushing up from the ground, you want to use those shoulder blade muscles to keep your shoulder in line with your chest instead of letting it slouch forward and put unneeded pressure on the front of your shoulder. If you try this tip and it doesn't seem to help you get rid of the chronic shoulder pain that you've been having, or if you have a history of dislocations and you aren't able to engage those muscles as much as you should, go ahead and call a neuromuscular expert, a physical therapist like myself, and we'd be happy to show you personalized exercises, but also help you with neuromuscular re-education, help you to re-talk to those muscles in your back, because if you haven't talked to them in a while, it can be tough to start that communication again. So call us up if you're struggling with using those shoulder blade muscles to open that chest and keep that humeral head in place in the socket rather than rounding forward and putting more pressure on the front of your shoulder.